the hallways kind of cleared out. I think I know most of you in the room. For some of you that I don't know, I'm Jean Hausheer, and I'm from the state of Oklahoma. And so I'm bringing you today a little bit of a controversial topic, but I think it's extraordinarily pertinent to today. I really wanted to thank everybody for all the really great talks so far. Great job. And I wanted to thank the residents for their posters, some of which are starting to be taken down, but I know those take some work, and I wanted to thank you guys as well. So raise your hand if you currently live in a state here in the U.S. or in a nation where there is legalized marijuana or CBD. Raise your hand. Okay. And then stand if you're in a state or a nation who currently have not legalized CBD or marijuana. Stand. Okay. So I'm asking Matt McCauley to pass out to the ophthalmologists in the room this flyer. It's a very succinct flyer. You can take it home. You can get it from the American Academy of Ophthalmology, and we contacted them, and they had no problem with me using that for you today. But it's something you can, if you live in a state like I do that has recently passed marijuana as legal, it's helpful to give that to your patients. And I would say to you, start to learn to talk to your patients and ask them directly, do you use marijuana? Because if you don't say that, they're not going to tell you, because you might be asked about illicit drugs, but unless you ask about marijuana specifically, in their mind, it's no big deal to use that. So I think this is really excellent, and I would tell you to feel free to take that home. I don't have any disclosures to make. Do you? So my background in marijuana, I just fell into this. I think it must have been a God thing, because I don't think, He puts you where He puts you for a reason, for a season, for a time. So a year ago in Oklahoma, I was placed into a position which is kind of an odd thing, but it happened I've only been there 7.5 years. But in 6 years' time, I became president of the Oklahoma State Medical Association, which was, for me, just a head scratcher. I don't even know how that exactly happened entirely. But it happened, and we had a state question with marijuana looming in our state. And it was a statewide initiative put out by the Green the Vote people, which are a very national group. And it was really the very broadest yet version of medical marijuana out there. So Oklahoma's state question had no medical conditions, yet it called itself medical 73 times in the state question. So as the incoming president, I was called upon by countless media, including television, forums, public forums, social media, everything under the sun, and I had to write a lot about it. And I really didn't know anything about it. I grew up in the 70s. I graduated in 1975 from high school, so marijuana was around then and very prevalent. So, I grew up around it, but I didn't really know anything about it as a physician because, like most of you, I wasn't taught anything, and so what I knew was only what I could read about. So I decided to really dive into the literature and really pay attention. And so I'm kind of a little bit of a geek about it these days because I read every week on the latest PubMed on what's going on. So unfortunately in Oklahoma, the marijuana industry did prevail, and we knew that they would. So there's still no medical conditions in Oklahoma. A physician can provide the marijuana certificate for either 2 years, or now we've got it fixed a little bit to where we can just do it for 60 days if we're concerned about a patient who's a known addict, which commonly they'll come to you. We can in Oklahoma grow our own pot with some broad limitations as well. So I think that this is a really great quote by Charles Baudelaire. The loveliest trick of Satan is to persuade you that he does not exist. So when we think about this overview, I can't cover all of this, but I will tell you one of the most frightening things as I've gotten into this has been children, which I'm going to spend a fair amount of time on. And the other thing where my heart is really concerned is the pesticides that are used. So like a bottle of aspirin is way more regulated than any kind of marijuana product, which they can spray whatever they want on it. And they do. And I have a lot of video that came to me through other physicians that I've met along the journey of last year. And they have given me really good video showing pesticides and how a gnat can land on some product that's being grown in the wild. And it dies in just a few seconds. And it's kind of hard to see it because there's also wildlife that dies quickly when it touches it, walks on it, anything. And so we just have unregulated issues with this product, and it's very concerning because they're using lethal pesticides on this just to make sure that it grows. So I'm not going to spend any time on that, but I'm just going to tell you it's a concern of mine. So I've read a lot of books too, and books are a little bit behind the literature, right, the research. But I think that if you're parenting through this time that we're currently in, I would really recommend this book. It's excellent. Alex Berenson is the author, and it's Children, The Truth About Marijuana, Mental Illness, and Violence. And I think it's really important to have those honest, transparent discussions with them. This is the other good book. It's by Ed Gochek, and it's a really good book. And he really just goes through from a parental standpoint, and he goes through very clearly about the issues we have that are different today with regards to the political landscape that we deal with, at least here in this country, as well as other countries as well. I think that as a physician, I would have to tell you my favorite go-to article came out in 2017 in January from the National Academies of Sciences and Engineering and Medicine. And there's nearly 100 conclusions on the health effects of marijuana and cannabis-derived products. And it's it's really the most comprehensive report. I'm sure we'll get more from them later. And I think it's worth reading if you're trying to grapple with this, because there's so many things as physicians that go beyond vision with this type of discussion. And I think that it's good to do that. You'll notice if you get involved in any public forums like I have done, that you have a lot of arguments that you'll hear from them that are just using a case report of a family member that was cured with their cancer by using cannabis. And, I know that it doesn't do that, and you should know that it doesn't do that. So it's really good to kind of get your head wrapped around what's vetted and what isn't vetted outside of the realm of ophthalmology. So I think that it's good to do that. Currently, cannabis is really the most popular illicit drug here in the United States. And there's a lot of surveys out there as well to support that. So let's start back in the 60s. So there was a counterculture drug of choice was marijuana at that point. And in 69, a Gallup poll showed that 4% of Americans had tried it. In 73, that Gallup poll increased to 12% of Americans. And in 77, this Gallup poll showed that 24% of American adults had smoked marijuana. So was this a random growth thing? It's a fair question. So if you think back during that era, the popular entertainment media promoted marijuana the same as they did opioids. Same. So nobody glamorized heroin. No comedy teams like Cheech and Chong. Anybody remember them? Cheech and Chong, or popular books, they never promoted shooting up heroin or LSD. LSD was very, very scary to everyone back in that day, and it still is today. Marijuana, though, it has shown up for years on comedy teams, hasn't it? Still probably today. I just don't watch a lot of TV. It's in our literature. It's in our movies. And it's always what? Positive, fun, happy, harmless, right? Sure. So the popular culture consistently presented marijuana as no big deal. Very safe, too. That's another thing they like to say. So in the 70s, marijuana legalization arguments, if we dissect what those three things were, because I was alive and well in the 70s, I was in high school then, it's the same arguments that are used today. You fast forward today. Number one, it's harmless. Number two, that alcohol is legal, so it's not fair to criminalize marijuana. And the third argument that's used is that it's wrong to put people in prison for using pot. So those are the three basic arguments. Have you ever heard those before? You heard them recently? Yeah, that's what they still talk about. So I think as physicians and physician family members, we really have to dissect what is research, what's vetted research, and we have to talk about it, because what I've learned in dealing with the public and these public forums, which I've been invited to a lot, is there's a lot of misuse of scientific data and findings to support a particular political belief. So in other words, like I said, they find a case report and they run with that and say that everyone's going to be cured of their cancer or whatever they're trying to say. So how do we then settle arguments when there are both sides that are cherry-picking literature and scientific findings? And I think that's where, as physicians, if we can bring that discussion into our patient base or into our family base or into our community, especially into our churches, that's a meaningful thing. And so it's important to eliminate studies that are very biased or skewed. We all know that those exist even today. Certainly, we have literature nowadays that has refuted what we knew in the 70s, right? But they keep touting the 70s as being the gold standard. So there's different findings nowadays. And if you start to study the research, as I have done, it's here in the U.S., this is a Schedule I drug, and so it's limited in human basis. Much of what we see here in the U.S. is sometimes in the VA hospital, they're able to do really good studies on PTSD and so forth on humans, but they also, it's a lot of it's mice here. And so you have to look to Iceland, and you have to look to other countries, and you'll realize that they really have got a lot of good human research on this topic. And so I think that's a very important thing on this discussion, and I certainly will cover the topic of glaucoma as well.
I was with my cousins, and we went to the park, and they were all in high school, and they were like, try this. And so I smoked some purple weed.
So I have a video that Ben queued up just a little bit early. Hold on, Ben. And so I've got some raw video that I'm going to show you that's shot by a high school kid, of high school kids, and I'm not quite ready for that, though. So driving high, I wanted to talk a little bit about that. And I would say the same thing. It's not just driving high, but it's riding a bicycle high. I think those two things I have to say you have to be careful of. So if you tell, the research and the evidence shows that if you tell marijuana users about the increased risk of accidents, that does not dissuade them from driving high or cycling high. Most marijuana users believe that it causes very minimal impairment in them. Most of them continue to drive stoned, despite research showing that it's very dangerous. The police that stop them and warn them and give them a warning ticket, that doesn't dissuade them. What does dissuade them is the police punishing them. Punishing users that are caught driving high has worked well to cut back on the number of stoned drivers. I want to take a minute and talk about schizophrenia because, as I mentioned earlier, one of my biggest hearts, and I didn't realize this till I started to study it, is kids. So schizophrenia, just because we have family members in the room, I want to just make sure we all know what that is a little bit. So it's an incurable psychiatric illness. It typically strikes teens in their 20s. And it's a form of psychosis. So what they have commonly is some disordered thinking. So they'll make a connection which makes sense to them, or the schizophrenic, but it doesn't make sense to anybody else. They'll have commonly delusions. That means that they'll purport that other people are controlling their thoughts, and they'll hear voices. And to them, the voices are very real, but they aren't to anyone else. They can't work. They can't go to school, and they need full-time, lifetime supervision and medications. So that's kind of the outline of that person. So marijuana, why would I bring that up with schizophrenia? Well, it causes schizophrenia, and this is vetted research, to develop 2 to 3 years earlier than in the non-users, and it can precipitate this illness of schizophrenia in people who would not have developed it otherwise. Now that gets your attention, doesn't it? So recent research has shown that marijuana-induced schizophrenia has 3 times the relapse rate of the non-marijuana users. So that's key. So in general, schizophrenia is only slightly associated with violence. When substance abuse is combined with schizophrenia, the risk of violence increases significantly. Research has shown that people with marijuana addiction are more prone to violence, and this tendency is independent of any other psychiatric illness or substance use disorder. SUD is the acronym we use for substance use disorder if you're reading about this stuff in the literature. So let's key that first segment of the video up. And again, Stan, I asked to remove foul language from this. You have to understand this is raw video. This is kids shooting other kids in video, but it's impactful, and I'll show you 3 segments. Go ahead and hit that.
I was with my cousins and we went to the park and they were all in high school and they were like, try this. And so I smoked some purple weed with them. It was like granddaddy purple or something, I don't know, it was something weird. And like I got so high. And then like from then on, we'd always go to the park and then they would always just give me a whole bunch of free weed because they thought it was funny that I was in the 5th grade and smoked. And then I was like actually hanging out with people. And then like a lot of those people are now in jail. I smoke every day before school, at lunch, on my way home from school, and then when I get back to my house I smoke, and then usually I like leave, come down here, smoke a whole bunch more, and then go back to my house and then smoke, and then shower, and then smoke again, and go to bed. I could smoke more. I really do.
It's pretty much a microcosm of Portland Public Schools. It's about 70% white, 30% non-white. I would say predominantly middle class to upper middle class. It's a very good school. It's a school people want to go to. I know that there are people who live in other attendance areas and play the address game to get here. It's highly regarded because of the IB program, because of speech and debate. And it's just generally seen as a good place to be. It's got a good brand recognition. The only chronic I have is just chronic headaches from having to do so much work.
Everybody that I know smokes weed. I know probably like 3 people that don't smoke weed, but they probably have smoked weed and will smoke weed with me, but they're not smokers. You know what I mean?
You know what I mean? That's good. Because it's everywhere. In Portland at least, you know what I mean? Like, shout out to everybody who's gone all their life without smoking weed. Like, good for you. Like, that's hard to do.
I think it's rampant. I think everybody uses it. It used to be kind of, it seemed like it was more of a culture. Certain people would use it. Now I think it's athletes, I think it's scholars, I think it's everybody. I mean, I don't think there's a clear-cut line who uses and who doesn't. I think it's more of a norm.
It's so easy for us to get weed to the point where it's like easier than getting water. All right. I've had mornings. I have mornings before where I've smoked weed before I've even ate anything.
In school, outside of school, in a car, outside of, everywhere. It's, you can smoke weed. People that don't care where they smoke weed anymore.
You know, it seems like every time I go out and I seek out information about one of my wrestlers or maybe somebody in my class that uses, I'm always surprised that it's more than I thought. And I always kind of assume the worst. It's always more than I expected.
Kids who regularly smoke, and I'm not talking about once a month or I smoked a joint behind my garage or something like that. I'm talking about regular usage or even coming to school. I think that shows that something is not right. To paraphrase Madeline, something is not right. Why do you need to put yourself in that state to come to school?
So we'll look at more of this in a little bit. I thought that would get your attention a little bit. So is marijuana addictive? Are they wrong? Should we care? So those who advocate legalization of marijuana do not want to accept that marijuana is an addictive drug, and they routinely leave this out of public forum conversations. Believe me, you have to go to those and you have to bring it up. Research recently has made it clear that marijuana is addictive so that even the advocates now can rarely deny it if you do bring it up. So instead, the advocates will make light of it and they'll imply that people can handle their marijuana addiction on their own. So as physicians, evidence has shown that addiction itself is not just physical dependence. If it were, Once users quit using for a few weeks, they wouldn't go back to using it again, would they? So addiction is diseased thinking. It's a mental craving, at times so intense that the addict is convinced they have to have the marijuana or whatever their drug of choice is. Substance abuse disorders have a persistent pattern of loss of control, causing repeated problems throughout their lifetime. There is cannabis withdrawal syndrome, and that's key as physicians that we recognize that it is a syndrome. We didn't know that until recently. So this includes things like it presents as unusual anger, aggression, low appetite, weight loss, irritability, nervousness, anxiety, restlessness, can't sleep. They get chills, depressed, stomach pain, shakiness, and sweating. So regarding addiction, needing isn't the same as wanting help with the disease of addiction. So addiction is called the disease of denial. The hallmark of the addict is that their insistence that they're not ill. And when we just look at current Americans under the age of 18, marijuana addiction pulls ahead of alcohol, pulls ahead of opioids, and it pulls ahead of heroin. So more teens are now addicted to marijuana than they are to alcohol. Research shows that marijuana addiction is now common and carries real potential to be severe. There are currently at least 4 million reported Americans and Canadians who are addicted to marijuana, and I said reported, so obviously there are more than that. Alcoholics, heroin, and cocaine addicts learn early on that addiction is a disease. Do marijuana addicts get that same message? I don't think so. So normally a drug that you take that would dumb down the brains of our teenagers, cause fatal car and bicycle accidents, and have millions addicted would be very condemned by our press. To the contrary, marijuana is more defended and even praised and celebrated by our local, national press and social media coverages. People in 2019 very much feel that marijuana is harmless, and we live in a world of marijuana denial that it would cause any type of problem. So marijuana stays in our human bodies or in the bodies of a user. It hangs out for an average of 3 to 4 weeks. So people only will recover from its effects if they totally stop using it for at least a month. So if you're looking for a drug screen, it'll be positive for up to a month after the last usage. So adolescents, even today, do respond to accurate information, and this is the message of hope that I bring to you, because this is daunting and overwhelming, this topic that I'm bringing to you today. So most adolescent marijuana use, including the heavy use, is really preventable. History's taught us that lesson. So if we are able to prevent teen marijuana use, we have to get hold of the news and the social media to show that there are negative truths behind this drug. Teens mostly will stay away from drugs if they know that they will get harmed. They'll make better decisions and good decisions if they have good information and good roles at home and good friend roles and models. So legalization of marijuana increases the use among both parents and their kids. Currently, there are 33 states here in the United States, including Guam and Puerto Rico, that have legalized it. So if you are standing because you don't have it yet in your country or in your state, you will. Legal drugs are generally more readily available to both teenagers compared to the illegal ones. 8th grade is when most kids are starting to use marijuana, although according to our video we just saw, 5th grade, meaning age 9 or 10, is really when a lot of them are starting. That's a wake-up call. Recent studies have shown that 20% of high school seniors report that it's really easy to find cocaine, meth, and heroin, but that's 20%. 80% of high school seniors report it's easy to find marijuana and alcohol. So it's easy. In the United States, there are more teens who've smoked marijuana back in 1978 than at any other time in history. I think we're going to beat that because things are really escalating as of recently. The belief that it's harmful has been rejected ever since 1978. And in 75, some research I would point you to if you're a parent looking at this situation. The University of Michigan has really conducted a great, large, ongoing study of teen marijuana behavior, attitudes, and they call it Monitoring the Future. That's the name of their project. And it's really shown and watched teen usage and monitored these kids long-term to see what's going on. So why did marijuana decline among teens in 1992? Parents got organized, and that's really the message of hope I'm going to bring to this group. So parents use science-based information to fight back against the popular image of marijuana as cool and harmless. They didn't blame their kids for using marijuana. They did blame the pro-marijuana lobby, news, and entertainment media. And the parent movement only lasted 14 years, and then it fell off, during which time the percentage of teens who believed marijuana was harmful doubled. So today, it's kind of the 70s all over again. The number of teens who believe marijuana is harmful is plummeting downward, and teen use is escalating. Politics today are different than they were in the 70s, aren't they? At least I think they are. I think they're more divisive. It's a different game. So should we, as believers, create maybe a bipartisan national coalition of parents again, just as a thought? The marijuana lobby is also different than it was back then. They're very well funded, extraordinarily well funded. And they ignore specialists. I'm here to tell you that. And they'll threaten you. I've had that happen. I had to get the FBI involved last summer in Oklahoma. To my office, we had, per day, 150 to 200 calls a day, recorded first and last names, and they gave their phone numbers. And I told our prayer group here last summer about it, and you guys prayed over it, and I thank you because God prevailed. And I took 2 weeks of that, and I finally told my department chair, and I told some people at the state of Oklahoma, and they told me I should get the FBI involved because there were death threats involving bombs. So I did, and this little FBI guy comes over. Turns out he lives not too far from us, and he says, well, ma'am, he says, they're not going to shoot you, and they're not going to hand-to-hand combat you. They're going to blow you up. I go, well, that's great. I said, because they're messing with the wrong chick at the end of my day. I'm always going to do what's right, and I'm going to heaven anyway. So, wow, fast way to get there. It's okay. And he looked at me like, you're different. And I'm like, And he goes, okay, here's my cell phone number. I want you to call me. He goes, you don't fear this stuff, do you? I go, no. I said, what I don't like is that it would frighten my husband or frighten my workers, my coworkers. My staff were terrified of this, but I wasn't. I just am kind of fearless. So you just have to understand, if you go front and center, which is what I ended up having to do in my situation. And I also ran into a lot of physicians who are very pro-marijuana, and I'm not anti-marijuana. I'm just anti-kids. I'm pro keeping it medical, but in at least in our state, we didn't have it. Today, though, is different than the 70s, and I would say this: our recovery and intervention nowadays for addicts and alcoholics is way better than what we had back in the 70s. So that's another positive on this note. So as adults, teen marijuana users have problems with executive function. They can't think, they can't plan, they can't problem solve, they have problems with decisions. Executive function can reside in our frontal lobes here in our brains, and it can make us differ from other animals who can't think beyond the moment. So without good executive function, we are like blissed out, stoned, drifting through life. So ideally, laws, in my opinion, from what I've read, and not just read a little bit of, but studied diligently in the last year and a half, we really should prohibit marijuana use until age 25 worldwide. Nobody should be driving or riding a bike high. That's the next cue up there. been. This is the same video, just a little bit more of it.
It was mostly just like I would get really terrible anxiety before going to school.
If it's an anxiety issue, what are the root causes of that anxiety?
Because middle school was horrible and high school wasn't much better. And then smoking was just seemed so much better than going to class and being miserable. But I dropped out of school and now I'm getting my GED. But yeah, I would just skip like basically every class to smoke weed and just meet up with my friends and smoke. Like, because in middle school I'd only smoke like once a week. Like, that would be a big deal.
When you first start out, you're like, I smoke today.
Yeah, because you just get so high, but then the more you smoke, the more your tolerance goes up,
like,
and then you need it more to even feel it.
People can stop smoking weed. I could stop smoking weed. It's just a matter of like, do you really want to? It's just a matter of want, not need, I think. But mooking, I definitely believe that it's a need. People, it's hard to stop mooking. It's extremely difficult. I've tried it. It's hard on like, not even like mental, because all you think about is wanting to take a mook, but also physically, you know what I mean? Like you sweat more, you're more agitated, you're more angry, because all you want to do is like this release, because the high you get from a mook is totally different than smoking weed.
A mook is when you put tobacco and weed in a bowl and smoke it. So if you've ever smoked a spliff, it's the same thing, but out of a bong. It's intense as you get a head rush and you just die.
It's like that part on Spaceballs when they go warp speed and like the whole,
people seize.
Whatever guys like flying around.
Seizures happen. So I stopped and now I'm just smoking weed and I get high as because it's great.
Yeah, I've seen multiple people seize.
People started mooking and everybody was like, oh, it's really gross at first in the first few months of school, and then it progressed, and then by the end of the year everybody was mooking pretty much.
We went to a mook party at Laurelhurst, and my friend took a mook with spirit, Doha, and nicotine oil on it, and she just lit it and hit it very fat, and then she just kind of like started like holding her mouth and like shaking, and then she went and laid down on the ground and started convulsing and just seizing out, and then we had to kind of help her and get her on her side, that way she could throw up. But then after she threw up, she was fine, and she just came and drank water.
Yeah, that's how the seizures work.
Mm-hmm.
Like, I'm sure if all the kids at our school were taught before they had a mook that it could give you a seizure, they probably wouldn't do it at all. But nobody's being taught that. Most of the teachers at our school don't know what a mook is.
No, I don't know anything about it, to be honest with you.
No, I am tragically or fortunately very unaware of the various incarnations of how to transport marijuana into your system.
I've heard about it, and when somebody was talking about it early in the year, and I was thinking that's something I've heard a lot, but I don't know what it is. And we haven't done our drug unit yet, and that was the mooking one. I've never even heard that. Dabs I've heard of, but there's stuff I haven't even heard of.
Dabs? Well, I dab my cheek when I'm kind of glistening from time to time, but no, I don't know what dabs are.
What you do is you extract the THC using butane or like some other thing. You vaporize off the butane, most of it, and then you have like pure THC concentrate, and then
just a dab.
Yeah, and then all you need is just a dab, and then it's like you smoke a fair amount of flower.
Wow.
Just take one hit, and yeah, suddenly very high.
Never heard of that one. Sounds kind of risky.
The first time I dabbed, I was dead. My friend choked me out over there. People started videotaping. I was just done. I couldn't compute.
It gets you so much more higher. Taking a dab, I've seen 400, 300-pound kids take one dab and are knocked. Like completely lights out, just asleep. Oil and dabbing became not really a thing to everybody because not everybody can take a dab and be okay.
You know, they'll try to dab and then their lungs can't even handle it, and they get so high that they forget to breathe sometimes and they pass out. That's what happens.
I think it's only select people who have like better lungs, can dab, and just like who don't see weed as getting high anymore because a dab can do more than that.
No, I don't really know. You know, other than probably opiates and painkillers and stuff like that, I don't really know what the drug culture is outside of it right now.
Weed's kind of like dialing down, and Xanax is definitely coming like up to be a new drug. When smoking was a huge deal last year, people were smoking a lot, but then you had homies who were like, hey man, like, you ever done Xanax before? And people were like, nah, I ain't never done Xanax before. Like, they want to try it. It's something new. It's like, you know, weed is old now. People just smoke weed, you know, everybody does it. It's not cool anymore. And then you do it once, you do it twice, you do it 3 times, you do it 5 times, you do it 10 times, and you're just madly addicted. I've seen seniors of your guys' class, you know what I mean, who just smoked weed before, and I used to kick it with them, and then they just got addicted to Xanax and stuff. And it's like, wow, the fact that like people can say, oh, weed isn't a gateway drug, weed isn't a gateway drug. That might be true. Like smoking weed, you're not gonna be like, I want to go do heroin now after smoking weed, you know what I mean? But because smoking weed and you smoke with a whole bunch of people, once a new drug is added to that group and the social like network and everything, it becomes a new drug, you know what I mean? Everybody wants to do that now.
So the governor of Oklahoma put me on the Oklahoma Opioid Overdose Fatality Review Commission recently, several months ago, like March. And we are now measuring marijuana in those fatality issues, trying to understand, because you heard him say how they introduce a new drug into their ring and they try it. And a lot of our deaths, at least in the regions, the counties that are highest in death in Oklahoma, are down in my neck of the woods, down in the rural area. And there's a lot of it, and there's a lot of commingling of multiple drugs, it seems. And so we're monitoring this and trying to learn from it. So if you can get involved in that kind of thing, even though we're just like ophthalmologists, and it's a rather gory idea, it's a good thing if you get a call from the governor's office, just say yes and go do that, because it's important to be involved and have a say in that. So physicians typically will support evidence-based treatments of medical or surgical conditions, right? Including marijuana and cannabis derivatives. So physicians have, for years now, advocated legalization of CBD oil, cannabidiol oil, for treatment of unresponsive pediatric seizures. It's not the first line drug of choice for that, but it certainly is something they go to in refractive situations which aren't responsive to other things. Physicians also typically encourage increased human medical marijuana research at the federal level. So it's Schedule 1, and a lot of people are trying to get them to flip to Schedule 2 so that we can study it better here in the U.S. in vetted clinical trials. Physicians guard patient safety by adopting standards used for all other prescribed medications, which is what we all do using required standards of care in the practice of medicine and surgery. So physicians ensure that patient access to all dangerous drugs goes through a very clear system of safety and liability controls that address appropriate concerns along the way. And as physicians, we typically will ensure public safety by developing these safeguards, such as consistent product labeling, controlled access and preventing secondhand smoke, and lethal pesticides. So some people in the back, I mentioned that they now make Pop-Tarts. And they have gummy bears full of this. And they have really yummy brownies, of course, and chocolate cookies and lots of things. So it's not just a smoking or a vaping, although that's the fastest way to get high. Just some basics: THC, tetrahydrocannabidiol. Just remember the tetrahydro, that's the high. THC is the high, that's the psychotropic. The CBD, cannabidiol, is not high. It's not addictive, it's not high. So there's more than that, but those are like two main terms. I think if you could keep those in mind, it's good. So as I mentioned, marijuana is a Schedule I controlled substance, so it's under federal law here in the United States. So physicians here in the U.S. follow at least 7 careful steps of careful validated checks and balances whenever we prescribe general prescriptions as shown in that light blue line on the top, or even the off-label prescriptions that we use as shown in the dark blue, the second line. So Schedule I controlled substances like opioids here in the U.S. are guarded at a 10-step level of careful validation before physicians prescribe each potentially lethal addicting med to a given patient. And as shown here in that long, light greenish yellow bar. So the bottom short bar, the green one, that's the 3-step bar, which is where marijuana is today here across the United States, on the other hand, even though it's a Schedule I controlled substance. So this is why you don't prescribe marijuana ever. You can give a certificate for it if you're a physician in that regards. So the standard of care is something I used as an argument. Of course, it went through deaf ears, but a standard of care is something we know as physicians. We're comfortable with it. It's a guideline we use. It's appropriate. It's scientifically evidenced and uses collaboration between medical and psychological professionals. We have ability to accept these standards, and it's just important that you be aware of that idea. So what are some current medical conditions that I would tell you we know are effectively treated by medical marijuana? Let me start by saying none of these are the first-line drug of choice, right? So we just finished a morning on glaucoma. Well, what's your first-line drug of choice, Dr. Sarkisian? You know, right? You don't go to this for your first line. That's the first thing you got to explain to a patient or a legislator. So there are 5 conditions, the first being epilepsy or seizure disorder that's unresponsive to other treatment. We know that CBD does work in pediatric epileptic situations quite well. It also works in nausea, vomiting situations from chemo, which are unresponsive to other forms of treatment. And who doesn't have compassion for an HIV/AIDS person or a cachectic wasting person or a cancer-type patient? Sure we do. Muscle spasticity, like with multiple sclerosis and Parkinson's. Again, it's not a first-line drug, but it does seem to work well for some of our patients. Number 4, relief for terminal illness, expected to live less than a year. So who doesn't have compassion for someone on hospice for whatever that reason is? And the 5th one is that wasting syndrome from HIV/AIDS or cancer. Because they throw up so much that they can't keep food, and this helps them kind of regain some appetite at times. So those are things that you can keep in mind. So the United States dispensaries and the pro-weed sites will claim cure and effective treatment for glaucoma. So I'm shifting now into eyeballs. And they base this on case reports of cure, and it's very irrelevant research data. And it goes back to the 70s, because we know in the 1970s you can find that really good article where they showed that THC, tetrahydrocannabidiol, did seem to lower pressure. So there are 3 entities I would say to you: the American Academy of Ophthalmology, who put this out for you, as well as the American Glaucoma Society, as well as the Canadian Association of Ophthalmologists, all agree medical marijuana and cannabis products should not be used for the treatment of glaucoma. So in February of this year, out of Indiana, there was published research that I thought was really interesting. So again, we couldn't do this in humans, we had to use mice, but it showed that CBD itself, which is the one, remember, that's not psychotropic, it does not lower intraocular pressure at all. In fact, it raises it. Mice were tested with pure CBD, and the intraocular pressure increased by 18% for 4 hours after instillation. Pure THC, or tetrahydrocannabidiol, administered to the same mice created a decrease in intraocular pressure by up to 30% within 8 hours of application. And it was uniformly higher in male than it was in female mice. Isn't that interesting? So there's still much we don't know about this drug, but I thought I would at least impart that to you. The other concern, and this is in your green little thing I sent out with you. So the other concern with smoking marijuana is that its known side effect of rapid heart rate and decreased blood pressure can potentially reduce the blood flow to an already compromised glaucomatous nerve. So that's something we don't know about, but we're watching and concerned about. as ophthalmologists. So glaucoma patients who would choose to ignore our warnings would need to smoke marijuana every 3 hours, 24 hours a day, 7 days a week. They'd be unable to work, unable to drive, ride their bikes, lead productive lives, and the cost of this associated high volume would be anywhere from $300 to $500 per month, depending on where you lived and how you used it. So it's prohibitive. When we have a single surgery or glaucoma medicine or drop that could last for 24 hours, much more cost effective and effective overall. So we're ready for that final key up there, Ben.
It's worse for you. It's a lot worse for you, obviously. I've seen friends like wasted on Xanax. I see people abusing it. I see people going from Xanax to going to crack now, you know what I mean? And it's just like a whole nother younger generation is just totally different than when I was like younger, at least. Because people just smoked, and now you have 8th graders doing Xanax, you have 8th graders doing coke. It's like, I don't know, it just changed completely. I'm so worried about our generation and the one right after us too. We, as like an older generation, we're smoking more, you know what I mean? We're doing more drugs, and then we're gonna leave it for them.
I'm 14. I started smoking when I was maybe 12 because my friend, he just introduced me when I was in 5th grade. So it's pretty new to me, but I get high pretty much, you know, every single day. I started smoking much more in the summer, so when I was a kid I didn't smoke as much, but now I'm smoking a lot, and I can tell there's like some problems with me. Like, I used to be really interested in school, but now I just want to get away from there, you know. I just like ditch school more. I'm having more like problems in school. I'm not focused that well, you know. Just like the schoolwork just seems out of it, you know. I used to be a really good student, getting like A's and B's, but now I'm noticing I'm getting F's and D's, so it does affect you. Sometimes it affects you in learning, because like I just come down here all day just smoking, so I'm not really in school doing much. And I need to stop too, but you know, it's fun doing it. It's just fun smoking.
It's like freshman Snapchat, so I just sent her a picture of you taking a mook.
I've had a couple people that I've been pretty close to, a couple students that I've been pretty close to, and they've got in trouble, and they're here at school, and they've been sent to desk, and they come out of desk, and they say the right things. It's like, okay, I see what I was doing. They're not in denial about what was going on, and they've kind of went through the program, and things are good, but then they get right back in their peer group, and slowly but surely, almost every student that I've known, they get right back into the same feelings, the same emotions, the same situations, and it starts again. I don't think that, and this is me, I don't think that we do enough. It seems like we talk about it in a staff meeting and then it goes away. Or we bring in somebody that will talk to the staff and then it's done with for a year or two. I think we need to address it head on. I think we need to address and face that we have a problem, acknowledge that we have a problem at our high school. And I don't know if that's a publicity thing that Portland Public Schools or Cleveland, and don't take this out of context, but maybe they just don't want that to get to the press. Maybe they don't know how to do it. Maybe they're trying and I'm just not seeing it. I don't know.
This is the hard part. For me, I wish that I never smoked weed. I wish that I never hit my first bong. I really wish I didn't, because one, it wasn't like it was smoking weed and that was fine, but then I started to mook and that became addictive and that became like a part of my life. I blew off work, I blew off school, I blew off girlfriends, I blew off homies just to smoke. And one night it hit me that like I was smoking alone, and it all hit me that wow, like weed is definitely like, smoking weed is something that it can become a problem. And to all like freshmen and all upcoming like freshmen and whatnot, I advise to experiment, but wait till your brain, or wait till you're at least like a senior or junior. Wait till your brain's a little bit more developed. The brain doesn't develop till you're 26 years old. Like, experiment. Yeah, we can experiment and smoke some weed. That's fine, but don't make it a huge deal in your life that you would blow off like your family for smoking. You blow off school. You blow up. You know what I mean? Do it responsibly.
So does marijuana produce withdrawal symptoms when a person stops using it? Yes. So the symptoms that they have are very similar to nicotine withdrawal. So they'll get irritability, sleep problems, anxiety, decreased appetite, physical discomfort, and that's the cannabis withdrawal syndrome that I mentioned earlier, but I think it's worth mentioning again. So symptoms can gradually disappear in a month, but I would say to you, and I spend a lot of time with the psychiatrists who treat these issues, and they would agree that marijuana addiction does require professional treatment to overcome it, same as anything else does. So how harmful are K2 and spice, which are synthetic marijuana products? So these consist of many human-made, mind-altering type chemicals that are sprayed or dried onto the shredded marijuana bud to be smoked. They're sold as smokable or vaped. They're dangerous products. They started back in the 80s. That's when I started seeing it in the emergency rooms. They've continued since that time. They haven't gone away. These are cannabinoids, but they're more unpredictable, and they're definitely more potent than the THC alone is. THC back in the 70s was different than now. Its content was about 5%, 8%, 10%, 12%. But now do you know kind of where it roughly is? Anybody have any idea if you read it like I do? Any idea? It's about 80%. So 70 to 80% in most product. And at least in Oklahoma, you can grow your own, so you can make it whatever strength you'd like. So our emergency rooms today are similar to back in the 80s, that we see a lot of particularly young people with rapid life-threatening heart rates and hallucinations. And these are very high risk for overdose. They get severe hemorrhaging with the K2 and the spice. And again, the pesticides I haven't even touched on today because there wasn't time, but it's important to realize that it's on that product commonly. So what are their effective treatments for people who are addicted to marijuana? Well, behavioral therapies are quite good. Similar to alcohol and other drug addictions, the motivational enhancement treatments are out there. They use cognitive behavioral therapies, and they teach strategies to kids for drug avoidance and its triggers and changing who you're with, your friends. So how can we tell if a kid has been using marijuana? If you're a parent or you hang with, there's kids in your neighborhood that you care about or in your church. So they'll commonly have some changes in their behavior. Maybe they're not brushing their hair or their teeth, or they're skipping all their showers, or they got unusual change in moods or friends showing up, change in their grades, skipping classes like you heard today, skipping school, loss of interest in sports or their other favorite things they like to do, changes in eating and sleeping patterns, getting in trouble in school or with law enforcement. Those are just some things that start to happen that you have to start to wonder. So if your kid is using marijuana, they might seem unusually giggly and coordinated. Their eyes are commonly red, bloodshot. They have a hard time recalling things that just happened. They may have drug paraphernalia such as pipes or rolling papers or vaping devices, and they'll claim that it's their friends. Have strange smelling clothes or bedroom type air, unexplained lack of cash on hand. So parentally, I just think it's good to have good listening skills all the time. Be an observer. Set some clear expectations with your kids about drug and alcohol use, including tangible consequences like we talked about with the police and the driving high, that you reliably will implement. Help your child to deal with peer pressure to use drugs, change their peers. Monitor your kids' whereabouts. Trust but verify. I think Ronnie Reagan said that well. Supervise your teen activities, be there. Talk to your kids throughout the day in person. I think there's greater acceptance of marijuana compared to alcohol and other illegal drugs. Whether or not marijuana is legal for adult use or allowed for medical use, it can be harmful for kids, and it can permanently alter the course of a young person, prevent them from ever reaching their full potential. And so my heart really is pertaining to kids when it comes to this particular topic. And I didn't start out that way, but I certainly over time have become that way. And if we did one thing and advocated in all the world to at least pause this stuff and don't make it legal for anyone under the age of 25 because of the science we know behind the developing brain, and that's really where that comes from. So 1 Corinthians 14 says that Satan is the author of confusion. He seeks to cause chaos, disorder, death, and destruction. And that's all I had for you today.